Welcome back. Almost 10 till 5 a.m. and some surprising trends when it comes to strokes. A brand new study finds a growing number of younger women are having them, but new research actually shows that more stroke patients are responding better to treatment even just hours after they first show those symptoms.
This morning, Christy Kruger, our medical specialist, takes a look at what causes these blood clots and how treatment options are changing in this morning's Heart of South Florida report.
Noelia Gutierrez enjoys every minute she can playing with her little girls.
Say Noah!
Just 8 days after the birth of her third daughter, the 30-year-old mother had a bad headache and a weird tingling in her hands. She called 911.
By the time I got to the hospital, I was already not talking properly. I was already slurring, dragging out my words, and not getting my words clearly across.
So just look at my nose.
Noelia is one of a growing number of pregnant or postpartum women to experience a stroke.
Good. So before?
Basically, it's a heart attack in the brain caused by a blood clot. It is most common in African American and Hispanic women.
During pregnancy and shortly afterwards, due to the hormonal fluctuations, it's known that the blood tends to thicken and increase risk for blood clot formation.
High blood pressure, smoking, and long-term use of birth control pills also play a role in clot formation and stroke.
We navigated with our catheters and devices up to that.
Doctors used to believe that those clots had to be removed within just a few hours to prevent brain damage, but the American Heart Association recently announced changes. Patients may have a bigger window of opportunity to get crucial treatment. Doctors removed Noelia's blood clot more than 12 hours after her first symptoms. She is a perfect example of why the American Heart Association is changing their guidelines when it comes to stroke treatment.
Some may have a very large stroke by the time 3 hours have elapsed, and others, even at 18, 19 hours, may have a very small stroke despite a significant blockage.
Doctors will look less at time and concentrate more on the brain tissue. In Noelia's case, once the clot was removed, she started to move and talk.
If they wouldn't have responded the way they did, my kids wouldn't have a mom, my parents wouldn't have a daughter, my friends wouldn't have me.
All right, well, despite those changing guidelines, doctors say the sooner you get medical help when you show signs of a stroke, the better your chances are for a recovery.
Still ahead for you this